What is anxiety? Anxiety is a natural response to stress or danger, characterized by feelings of worry, fear, or unease. While occasional anxiety is normal and can help people stay alert or perform better, excessive, persistent, or uncontrollable anxiety can interfere with daily life and may indicate an anxiety disorder. Types of anxiety disorders. 1. Generalized anxiety disorder, GAD. Excessive, ongoing worry about everyday issues like work, health, or finances, often disproportionate to the actual situation. 2. Panic disorder. Sudden, recurrent panic attacks marked by intense fear, physical symptoms, e.g., racing heart, sweating, and feelings of losing control or impending doom. 3. Social anxiety disorder, social phobia. Intense fear of being judged, embarrassed, or humiliated in social situations. 4. Specific phobias. Irrational fear of specific objects, situations, or activities, such as heights, animals, or flying. 5. Separation anxiety disorder. Extreme fear of being separated from loved ones, often seen in children but can also occur in adults. 6. Obsessive-compulsive disorder, OCD. Formerly classified under anxiety. Persistent, unwanted thoughts, obsessions, and repetitive behaviors, compulsions, aimed at reducing anxiety. 7. Post-traumatic stress disorder, PTSD. Formerly classified under anxiety. Anxiety triggered by a traumatic event, leading to flashbacks, nightmares, and heightened arousal. Symptoms of anxiety. Emotional symptoms. Excessive worry or fear. Restlessness or feeling on edge. Difficulty concentrating. Irritability. Physical symptoms. Rapid heartbeat, palpitations. Shortness of breath. Sweating or chills. Muscle tension or aches. Fatigue. Sleep disturbances, insomnia, or excessive sleep. Causes of anxiety. Anxiety can result from a combination of factors, including 1. Biological factors. Imbalances in brain chemicals like serotonin, dopamine, and norepinephrine. Overactive amygdala, the brain's fear center. 2. Genetics. A family history of anxiety disorders increases the risk. 3. Environmental factors. Stressful life events, trauma, or adverse childhood experiences. 4. Personality traits. People who are more sensitive, perfectionistic, or prone to negative thinking are at higher risk. 5. Medical conditions. Chronic illnesses, e.g., thyroid disorders, heart disease, or substance abuse. Diagnosis of anxiety. 1. Medical history and physical exam. Rule out underlying medical conditions causing symptoms. 2. Psychological evaluation. Assess thoughts, feelings, and behaviors to identify patterns of anxiety. 3. Diagnostic criteria. Based on the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, specific criteria must be met for different anxiety disorders. Treatment for anxiety. 1. Therapies. Cognitive behavioral therapy, CBT, helps identify and change negative thought patterns. Exposure therapy. Gradual exposure to feared situations to reduce sensitivity. 2. Medications. Selective serotonin reuptake inhibitors, SSRIs, e.g., sertraline, fluoxetine. Benzodiazepines, short-term use, e.g., lorazepam, diazepam. Beta blockers, reduce physical symptoms like rapid heartbeat. Buspirone, specifically for GAD. 3. Lifestyle changes. Regular exercise to release endorphins and reduce stress. A healthy diet and reduced caffeine or alcohol intake. Mindfulness practices like yoga or meditation. Adequate sleep to restore mental balance. 4. Support groups. Sharing experiences with others can reduce feelings of isolation. Coping strategies for anxiety. Deep breathing. Practice slow, deep breaths to calm the nervous system. Grounding techniques. Focus on your senses, e.g., describe 5 things you see or touch to stay in the present moment. Time management. Break tasks into smaller steps to reduce overwhelm. Positive self-talk. Challenge negative thoughts with rational, positive ones. When to seek help. If anxiety significantly interferes with daily life, work, or relationships. If physical symptoms, e.g., chest pain, dizziness, are frequent or severe. If anxiety leads to avoidance of important activities or places. If you experience panic attacks or thoughts of self-harm. Early diagnosis and treatment can help manage anxiety effectively and improve quality of life.